Introduction: the surprising truth about fruits for seniors. It's astonishing to discover that some fruits, widely regarded as nutritious, can actually hasten aging, impair cognitive function, and cause blood sugar spikes worse than a sugary soda. A recent study published in the Journal of Clinical Nutrition uncovered that adults, aged 65 and older, who regularly consumed certain high-sugar fruits, faced a staggering 57% increased risk of metabolic syndromia, serious health condition tied to diabetes, stroke, and heart failure. What's truly alarming is that these fruits are often touted as wholesome or digestion-friendly, yet they may be silently undermining your health with every bite. For seniors over 65, age-related changes like a slower metabolism, more fragile cells, and a reduced ability to process sugars mean that choosing the wrong fruit can lead to rapid and severe health consequences. Your body simply doesn't handle sugars the way it did in your younger years, making fruit selection critical. On the flip side, there's encouraging news. Certain fruits act as nature's medicine, offering older adults remarkable benefits like lower blood pressure, stronger cardiovascular health, and a rejuvenated brain that feels years younger than your chronological age. In this video, we're unveiling the 4 essential fruits that seniors should make a staple in their daily diets, along with the 4 fruits they must avoid at all costs. Pay close attention to the final fruit on the danger list. It's delicious, hydrating, and a fan favorite, but it could be quietly draining your vitality and shortening your lifespan. Before we dive into the details, we'd love to connect with you. Drop a comment below with your location, give this video a thumbs up, and hit that subscribe button to join our community for more life-changing health insights. Let's get started without further ado. Main point 1. Avocado, a nutritional powerhouse for heart and eye health. Kicking off our list is the avocado, a fruit that's often mistaken for a vegetable but deserves a spotlight for its incredible benefits for seniors. Gone are the days when dietary guidelines demonized all fats. Avocados are now celebrated as one of the healthiest foods older adults can incorporate into their diets. What makes avocados so special? Their high content of monounsaturated fats, particularly oleic acid, which research shows can significantly lower harmful LDL cholesterol while boosting beneficial HDL cholesterol. For seniors dealing with cardiovascular challenges, this unique fat profile is a lifesaver, reducing the risk of heart attacks and strokes by improving overall cholesterol balance. But the benefits don't stop there. Avocados are a potassium powerhouse, delivering around 975 milligrams per fruit more than the much-hyped banana. Potassium is critical for managing blood pressure, a pressing concern for the nearly 23% of adults over 65 diagnosed with hypertension. By counteracting the effects of sodium and relaxing blood vessel walls, avocados help maintain healthy blood pressure levels naturally, often reducing the need for additional medications. Imagine enjoying better heart health simply by adding a fruit to your meals. Avocados also shine in supporting eye health, thanks to their rich supply of lutein, an antioxidant carotenoid that protects against age-related macular degeneration, a leading cause of vision loss in older adults. This is especially crucial as vision changes can impact independence and quality of life. Another lesser-known advantage is avocado's ability to supercharge nutrient absorption. Many vitamins in vegetables, such as vitamins D, E, and K, are fat-soluble, meaning they need fat to be properly absorbed by your body. Pairing avocado with a salad or cooked greens can increase nutrient absorption by up to 15 times, making your meals far more effective without relying on a cabinet full of supplements. How can you unlock these benefits? Just half an avocado daily is enough to transform your health. Spread it on whole grain toast for a hearty breakfast, blend it into a creamy smoothie, or scoop it straight from the skin with a squeeze of lemon for a refreshing snack. Avocados are versatile, delicious, and a true game changer for seniors looking to thrive in their golden years. Whether you're managing cholesterol, blood pressure, or simply aiming to stay vibrant, this fruit is a must-have. Main point 2. Apples, a fiber-rich champion for gut and heart wellness. Next up is the humble apple crisp, juicy, and packed with benefits that make it a top choice for seniors. Apples are loaded with fiber, particularly a type called pectin, which acts as a prebiotic, feeding the beneficial bacteria in your gut. A healthy gut is essential as we age, supporting better digestion, a stronger immune system, and enhanced absorption of nutrients, three factors that become increasingly vital with each passing year. Poor gut health can lead to discomfort, weakened immunity, and even nutrient deficiencies, but apples help keep your digestive system in top shape. What sets apples apart is their profound impact on heart health. The pectin in apples binds to cholesterol in the digestive tract, helping to remove it from the body and gradually lowering LDL cholesterol levels. Apples are also rich in flavonoids, such as quercetin, which have potent anti-inflammatory properties and support cardiovascular function. These compounds help reduce the risk of heart disease, a critical concern for seniors. Despite their sweet flavor, apples have a low glycemic load, meaning they don't cause the sharp blood sugar spikes that can exacerbate insulin resistance or type 2 diabetes. Their fiber content slows sugar absorption, keeping your energy levels stable and preventing those dreaded crashes. Apples are also incredibly satisfying, thanks to their high fiber and water content, making them an excellent tool for appetite control. This can be a boon for seniors looking to maintain a healthy weight without feeling deprived. Here's a surprising perk. Chewing apples stimulates saliva production, which helps reduce the risk of cavities and gum disease, common issues that become more prevalent with age. Whether you prefer a tart green Granny Smith, a sweet red Fuji, or a balanced yellow Honeycrisp, apples are one of the most accessible and versatile fruits. Incorporating just one apple into your daily routine, whether as a snack, sliced into oatmeal, or baked with a sprinkle of cinnamon, can support your heart, gut, and overall vitality in remarkable ways. Main point 3. Pomegranate, a vibrant elixir for heart and brain health. Third on our list is the pomegranate, a ruby red fruit that may not be your first thought for a daily snack, but is a true treasure for seniors. As we age, our arteries lose elasticity, leading to reduced blood flow, elevated blood pressure, and increased strain on the heart. Pomegranates are packed with punicalagins, powerful antioxidants that, according to research in the Journal of Atherosclerosis, can reduce oxidative stress in the arteries by more than 30%. These antioxidants are 3 times more potent than those in red wine or green tea, fighting inflammation and preventing artery narrowing. Think of it as clearing rust from aging pipes to keep blood flowing smoothly. Studies also show that pomegranate juice can lower systolic blood pressure by 521% in people with hypertension, offering a natural, medication-free way to manage this common senior health issue. But pomegranates don't just benefit the heart, they're a brain booster too. A UCLA study found that older adults who drank pomegranate juice daily showed significant improvements in verbal memory tests compared to those who didn't, addressing one of the most feared aspects of aging. Cognitive decline. Memory loss can erode confidence and independence, but pomegranates help keep your mind sharp. Pomegranates also support dental health, with juice offering benefits without the need for chewing, which can be helpful for seniors with dental issues. While antioxidant supplements show promise, whole pomegranates provide additional fiber and micronutrients that pills can't match. You don't need to down a full glass of juice daily, just half a cup of pomegranate seeds sprinkled on yogurt, or a splash of juice in your morning smoothie delivers powerful benefits. With a low glycemic index, pomegranates won't spike blood sugar, making them ideal for seniors managing prediabetes or type 2 diabetes. When choosing pomegranate products, opt for 100% pure juice without added sugars to maximize benefits. If you're on blood thinners, consult your doctor, as pomegranates may have mild interactions with certain medications. This fruit isn't just about health, it's about extending your vitality, keeping your heart youthful, and enhancing your quality of life for years to come. Main point 4. Berries, nature's anti-aging superstars. Topping our list are berries, blueberries, raspberries, and blackberries unmatched for their age-defying benefits. These tiny treasures are a senior's best friend, particularly for their impact on brain health. Berries are rich in anthocyanins, natural compounds that give them their vibrant colors and act as potent antioxidants. These compounds reduce inflammation in the brain and improve communication between brain cells, keeping your mind sharp. Research published in the Annals of Neurology revealed that seniors who ate just 2 servings of blueberries weekly delayed cognitive aging by up to 2.5 years, effectively maintaining the mental acuity of someone significantly younger. Berries' ability to cross the blood-brain barrier allows them to neutralize oxidative damage, protecting brain tissue and enhancing memory, balance, and coordination. This is critical for preventing falls, a leading cause of injury among seniors. Beyond the brain, berries offer remarkable cardiovascular benefits. Studies show that older adults who regularly consume berries experience lower blood pressure, improved arterial flexibility, and reduced inflammation markers, significantly cutting the risk of heart disease, the #1 cause of death in seniors. Berries also excel in blood sugar management. Their fiber and bioactive compounds stabilize glucose levels after meals, preventing spikes that can worsen diabetes or pre-diabetic conditions, which are common in older adults. With about 8 grams of fiber per cup, berries support healthy digestion and regular bowel movements, gentle on sensitive stomachs. Adding 1 cup of fresh or frozen berries to your daily oatmeal, yogurt, or smoothie can boost energy, sharpen focus, and elevate your mood. Avoid dried berries, which often contain added sugars that undermine their benefits. Whether you choose blueberries for their brain boost or raspberries for their tangy flavor, berries are a delicious way to stay vibrant and healthy. Main point 5. Grapes, a deceptively risky sweet snack. Now, let's shift to the fruits seniors should avoid, starting with grapes. At first glance, grapes seem like a perfect snack, sweet, refreshing, and packed with antioxidants, especially in red and black varieties. But for seniors, they pose hidden dangers. Their high sugar content, 23 grams per cup, comparable to a small candy bar combined with low fiber, leads to rapid blood sugar spikes, a major issue for older adults managing glucose levels. These spikes can contribute to weight gain, inflammation, and an increased risk of type 2 diabetes, all of which hit seniors harder due to age-related metabolic changes. Non-organic grapes often carry pesticide residues, which can be particularly harmful for seniors with weakened immune systems or sensitive digestive tracts. Unlike apples or pears, grape skins offer minimal nutritional value, making them less beneficial than other fruits. The ease of popping grapes by the handful makes it easy to overconsume sugar without realizing it, wreaking havoc on your energy, weight, and metabolic health. While grapes aren't inherently unhealthy, they're a risky choice for seniors prioritizing stable blood sugar and overall wellness. Main point 6. Dried fruits, a concentrated sugar bomb. Next on the avoid list are dried fruits, such as raisins, apricots, or dates, which may seem like a healthy, portable snack, but pose significant challenges for seniors. The drying process removes water, concentrating the fruit's natural sugars to alarming levels. A small handful of dried apricots contains as much sugar as several fresh ones, but without the fiber or water to signal fullness, making it easy to overindulge. For seniors with diabetes or insulin resistance, this sugar overload can cause severe blood glucose spikes, increasing the risk of complications or even triggering type 2 diabetes over time.
These sugar spikes also fuel inflammation, worsening conditions like arthritis, affecting nearly 50% of seniors over 65, accelerating cognitive decline, and weakening the immune system, a critical concern for older adults. Many commercially produced dried fruits contain sulfites, preservatives used to enhance color and shelf life. Sulfites can trigger severe asthmatic reactions in sensitive individuals, particularly seniors with age-related respiratory issues like COPD or asthma. About 1 in 100 people have sulfite sensitivity, with higher rates among older adults. For seniors with inflammatory conditions, the combination of concentrated sugars and chemical preservatives makes dried fruits a risky choice. Main point 7. Green bananas, a digestive disaster. Third on the avoid list are unripe green bananas. While ripe bananas with brown spots are a nutritious option, green bananas come with significant drawbacks for seniors. Their high levels of resistant starch, unlike the digestible sugars in ripe bananas, resist breakdown in the small intestine, leading to bloating, gas, and abdominal discomfort. For seniors with age-related digestive changes, such as reduced enzyme production or slower gut motility, these symptoms can be particularly pronounced. Conditions like irritable bowel syndrome or inflammatory bowel disease, more common in older adults, exacerbate the issue. Resistant starch can also interfere with nutrient absorption from other foods eaten at the same meal, a serious concern for seniors who may already struggle with nutrient deficiencies due to medications, reduced appetite, or metabolic changes. The astringent compounds in green bananas, responsible for their chalky texture, may irritate the digestive tract, potentially causing inflammation in sensitive individuals. Nutritionally, green bananas lack the antioxidant content of ripe ones, which increase during ripening, making them less effective for combating inflammation. For seniors seeking fruit's health benefits, green bananas are a poor choice compared to their ripe counterparts. Main point 8. Grapefruit, a medication minefield. Topping the avoid list is grapefruit, often hailed as a weight loss superfood but a potential health hazard for seniors on medications. Grapefruit contains furanocoumarins, compounds that inhibit the CYP3A4 enzyme in the intestine, which is essential for metabolizing approximately 85 common medications. This inhibition causes drug levels to build up in the bloodstream, as if you've taken a much higher dose than prescribed, leading to dangerous side effects. Affected medications include statins, for example, atorvastatin, simvastatin, blood pressure drugs, for example, nifedipine, anti-anxiety meds, for example, buspirone, and anti-arrhythmia drugs, for example, amiodarone, many of which are commonly prescribed to seniors. For example, eating grapefruit while taking Lipitor can increase the drug's concentration by over 400%, raising the risk of severe side effects like muscle breakdown or kidney failure. Shockingly, just half a grapefruit or a small glass of juice can trigger these interactions, with effects lasting up to 72 hours, so spacing out consumption doesn't help. Given the widespread use of these medications among seniors, grapefruit poses a significant, potentially life-threatening risk. Always consult your doctor or pharmacist before consuming grapefruit or its juice if you're on any prescription drugs. What seems like a harmless fruit can have catastrophic consequences, making it the top fruit to avoid. Conclusion: here's your ultimate guide to fruits that can either enhance or jeopardize your health as a senior. Avocados, apples, pomegranates, and berries are nutritional powerhouses that slow aging, sharpen your mind, and strengthen your body, helping you thrive in your later years. Conversely, grapefruit, dried fruits, green bananas, and seemingly innocent grapes can quietly sap your energy, spike blood sugar, and increase inflammation, undermining your vitality in subtle but serious ways. The most unsettling part? Many people don't realize that a handful of grapes or a green banana can set off a chain of health issues, often only noticed when damage is done. Make informed choices, enjoy your fruits thoughtfully, and pair them with protein or healthy fats for balanced nutrition. We're curious to hear from you. Which fruit on this list surprised you the most? Are you unknowingly eating these risky fruits? Have you ever experienced unexpected side effects from a fruit? Share your thoughts and stories in the comments below. We're eager to hear them. Thank you for watching, and don't forget to like, subscribe, and hit the notification bell for more health tips to help you live your best life.